My name is Justen Ahmad. I'm currently a medical student in Washington, D.C., but on Friday I graduate, and this summer head to residency in Iowa to train in family medicine. Finding a residency is complicated, and throughout the process, against advice from older doctors, I stayed true to my values and asked direct and open questions about the kind of healthcare I want to practice. During interviews with programs across the country, I found myself surrounded by like-minded healthcare providers that understand access to abortion care, gender-affirming care, housing, and more are key to providing for our patients. The state I will be training in, my home state, has repeatedly tried ways to restrict or ban abortion care over the years, but the state Supreme Court has blocked each of those attempted laws due to their unconstitutionality and cruelty. This reality made me feel like I could choose my program, knowing that I would be able to properly learn and prescribe necessary medical procedures for the well-being of my patients. On my first rotation in med school, I was assigned to OB-GYN, and my very first patient was a surgery for a young mother who was pregnant with her third child. She loved her kids and wanted more of them. However, something had gone wrong with this pregnancy. And early in the second trimester, her body attempted to naturally abort the fetus, but the remains stayed in her uterus, making her become very sick. To avoid further complication, my team performed what is called a dilation and curettage, a manual abortion. But it was too late, and the patient's body had developed a reaction to the remains of the fetus, causing her to bleed uncontrollably from all over her body. The only way to stop the bleed was to remove the source of the reaction, which meant, in the end, a complete hysterectomy, taking with it the patient's dreams of birthing a larger family. This story was tragic, but if, and now when, Roe v. Wade is overturned by the Supreme Court of the United States, individual states will be able to pass laws criminalizing abortion seekers and providers, or enact laws they had waiting in the wings for just this moment. We've already seen local jurisdictions misusing these laws to traumatize people seeking abortion care. And since there's no way to confirm an abortion is really elective or not, these laws could be used against people like my patient, my team, and for me, providing this necessary procedure. It's time now for everyone who cares about access to safe and necessary medicine to speak up and work to create laws at the state and federal level to codify and protect access to abortion. Call your elected officials. Ask them to support access to abortion. If you're a clinician, learn how you can prescribe, refer, or provide these services. I'm about to be a family physician. My education has taught me about the science and humanity of healthcare, entrusting me with great responsibility in society. And I will always support a person's right to choose.